Welcome back to the Dark Reading News Desk here at Black Hat USA. Terry Sweeney here with Dark Reading, and joining me now is Theresa Lanowitz, Head of Cybersecurity Evangelism for AT&T Business. Theresa, welcome back to News Desk. Always nice to see a familiar face.
Thank you so much, Terry. It's great to be back here with you.
Appreciate you doing this. We are talking about edge computing and healthcare. Talk a bit about how edge computing is in fact revolutionizing healthcare.
Yeah, so the healthcare field right now is undergoing massive innovation, massive change because of what we see with edge computing. And with edge computing, you have to really say, well, what do you mean by edge computing? You know, if you ask 10 different people, you get 12 different answers, right? So the way we defined it in the research that we did on healthcare and edge computing is we said it is software defined. So it is software defined on-prem or in the cloud. It's also your workloads, your applications you're hosting. It's closer to where that data is being generated and consumed, because edge is really all about that data, that digital first, data-driven experience. And it's also a distributed model of management, intelligence, and networks. And so if you think about healthcare, you say, all right, what sort of application does that have in healthcare? Think about the last time you went to a doctor's office. All of the endpoints, all of those devices, those devices that are measuring your vitals, those payment systems, anything that is connected to the internet, those are all endpoints that are being taken care of inside healthcare.
Okay.
So we have to worry about securing those, all of those endpoints from the edge computing perspective.
Do you envision edge computing being virtual, getting spun up like containers, for example?
In a way, but if you look at edge computing, what it's really doing is it's really this new era of computing. And it's really driven by networks that are lower latency and higher bandwidth, so faster, lower latency, higher bandwidth. It's also driven, your applications are completely different. So it's not those GUI-based applications that we've been used to over the past couple, 3 decades. It's really machine-to-machine communication. Those applications are applets, if you will, that are ephemeral and come together on an as-needed basis. And it's about delivering that digital-first experience to that consumer, whether that is in a business-to-business model or in a business-to-consumer model. So it's that next generation of computing. You know, you're not taking your smartphone and opening an app, you're not tethered to your laptop opening an app. It is something that is giving immediate information. It's something that is connected to the internet, something that is digital first.
Well, let's talk more about how it's being used. What are some of the common use cases of edge computing in healthcare, particularly that are affecting, say, the patient experience?
Yeah, so in our AT&T Cybersecurity Insights report, focus on healthcare, we have a core report, our AT&T Cybersecurity Insights report, and now this healthcare report is a double click on that core report, if you will. And we found 5 big use cases that healthcare professionals told us that they were doing. The first is teleemergency medical services. The second is immersive medical training. Then we have consumer virtual healthcare. You have a video appointment with your doctor. And then it's also this idea of hospital at home. You go home after some sort of surgical procedure, your home then becomes a hospital. So you're connected through different types of endpoints, through monitoring devices to monitor that patient remotely. And then this is one that I really find interesting, is the use of drones and autonomous robots in healthcare settings. So the use of robots, for example, in a healthcare setting is, imagine being able to have a robot deliver supplies to a nurse's station. It's very fast, it's very efficient, it gets to where it's going in the right amount of time. Using a robot for disinfecting an exam room, for example, after a patient leaves, disinfecting a hospital room between patients, that sort of thing. So there are all these really great and innovative use cases that are coming out there. And the really, really great thing we found from a security perspective is that across the board, our healthcare survey respondents said to us, you know what, we're really investing in healthcare, we're really investing in security along with applications, along with planning, and along with networking.
Right.
So of their total edge budget, they're saying security is really something that's front and center, which is great because, you know, security has always been sort of one of these afterthoughts.
Often tacked on at the end, as we know from hard experience.
Yeah.
With that in mind, how can security leaders best prepare to secure this evolving healthcare edge ecosystem?
Yeah, one of the things that we found is that healthcare organizations said, you know what, we realize we need help in doing this. This is something new. We're not going to do it alone. So these silos that we've seen built up over the past 3, 4, 5 plus decades, they're finally starting to erode. What we found out is that 71% of healthcare professionals say that once they get to the point where they have deployed an edge computing use case, they're bringing in some sort of third-party trusted advisor. So they're bringing in a consultancy, managed security services, global systems integrator, and so on. So it's this idea of having somebody help you, because this is a brand new type of computing. So, and the other thing is really, making sure that you understand what you want your outcome to be. What do you want this edge computing use case to do? And then budget appropriately. And we're seeing balanced investment, which is really, really wonderful, where security has that full seat at the proverbial table. And then really make sure that you're working with those trusted advisors out there to help you in the planning efforts, to help you in the production efforts.
What are you seeing as the biggest challenge to securing edge computing? What's hardest about that?
I think that there's a lot. It's a lot. And one of the things we found in our core AT&T Cybersecurity Insights report is that the more edge use cases an organization brought on, the more they said we're concerned about cybersecurity controls. So if they just had one edge use case, they might say, well, we're going to go with our legacy cybersecurity controls. But the more use cases they have for edge computing, they're saying the more they are concerned about security controls that maybe they haven't used in the past.
Is edge computing just another environment or another specific endpoint?
Yeah, it's that next generation of computing.
Okay.
It's about delivering that near real-time experience to that consumer, whether it's business to business, business to consumer. It's that experience, it's that idea of saying that we don't have to be tethered to a keyboard, to our laptop, to our desktop, to our phones, to our tablets. It's not about interacting keyboard. It is about that information is given to you in a near real-time fashion. So in healthcare, think about those connected devices, monitoring your vitals. Think about a patient at home after a surgery with some type of wearable to be able to send vital signs back to a doctor who might be monitoring that patient.
The security and IT budgets are shifting to support this transition to secure edge computing. How do you see that happening? How obviously delivering technology in healthcare is more than just does the box or the application do what it's supposed to do. There's a whole host of legal and regulatory and compliance pieces that also have to be met.
Yeah, and
help us understand that.
Yeah, that's why that whole ecosystem, bringing in those trusted advisors to help,
okay,
whether they are from a technology perspective, from a business perspective, from some type of compliance perspective, working with that holistic ecosystem really is critical for edge computing. And what we see is our survey participants have told us time and time again, this is too important. The stakes are too high. We're dealing with these very critical situations. So it's not about let's just throw some code over the fence
sure,
and see what happens, right? So we've moved away from that, and we see more cross-functional communication and collaboration, more of the line of business. In fact, when we did our survey, we made sure to include the line of business, so the line of business can give us some concerns that they have to deal with as well. As you mentioned, other types of things, compliance, regulations, that sort of thing, that especially in something like healthcare, you have to be very concerned about. So it's about having that expanded ecosystem that you can actually work with and find some guidance with as well.
Theresa, take us out with a prediction. We're sitting here, it's Black Hat 2026. What do you imagine for edge computing's use within healthcare within the next 3 years?
Yeah, the use cases are going to continue to grow. What we learned this year in 2023 is that 53% of our healthcare participants said that their top endpoint was a mobile type of device. What the other 30% told us is they said, you know what? In the next 3 to 5 years, we're bringing in things such as wearables, autonomous drones, robots.
Of course.
So we're going to see the endpoints become far more diversified. We're going to see far greater types of endpoints, and we're going to see these use cases expand. Just between 2022 and 2023, we've seen use cases in healthcare expand. So we're going to continue to see that expansion. We're going to continue to roll them out, and people will be able to reap the benefit from them.
Well, great perspective on the future of healthcare and security in healthcare. Best of luck with edge computing, Theresa. Appreciate you again stopping by the Dark Reading News Desk.
Thank you so much. It was great to be here, Terry.
We've been talking with Theresa Lanowitz of AT&T Business. This has been Terry Sweeney for the Dark Reading News Desk. Thanks for joining us for this segment. We'll see you soon.